From Wana Brands, welcome to Enhance Your Life. I'm your host, Jonathan Small, and each week I talk to people from all sorts of professions and backgrounds about how cannabis has enhanced their lives and how this healing plant can enrich your life too. Hey everybody, welcome to the Enhance Your Life podcast. My name is Jonathan Small, and I am so pleased to have you today. We've got some great guests. Really looking forward to this conversation. With me today is Katherine Golden and Jennifer Axcell. So Katherine is the CEO and co-founder of Leaf 411, and she is also a registered nurse. Jennifer Axcell is the COO and co-founder of Leaf 411. Now you might ask, what is Leaf 411? It is a free cannabis-trained nurse hotline. And Leaf 411 is on a mission to provide education and directional support to the general public about the safe use of legal cannabis. They are a free hotline for cannabis users. I can't believe this exists. I wish I knew this existed 3 months ago when I was freaking out because I had eaten one too many edibles. But anyway, I'm so happy to find you guys now.
Thank you. Happy to be here.
Tell me a little bit about the origin story of Leaf 411. Why did you guys start, and how did you start?
Yeah, sure. So Jennifer and I met in a cannabis clinician's office here in Colorado, and just really wanting to do large-scale outreach. So it was something, as a nurse, it's always in our heart, and it's our passion to really, we're educators, whether we're in the hospital setting or outside of the setting, we're educators at heart. So getting information to everyone, no matter what their level of income, no matter what their level of accessibility is, it's wanting to get balanced information about safe and effective use. And effective use is really key. And we've kind of evolved with that because, as we have launched a year ago with the hotline, I actually staff the hotline as well. And hearing people using it ineffectively is a problem as well. So it's not only safety, but also using it to the best of its potential and guiding our consumers with some of the key information they need to use it the way it's meant to be used.
Yeah, and I can speak to that from a personal experience. I'm a cannabis patient myself. After a severe car accident left me dependent on a bunch of different pharmaceuticals. And because Leaf 411 didn't exist at the time, I consulted Dr. Google and got a bunch of, information. I thought, okay, this is it. And it was trial and error on my own. And with regards to my pain, I basically got to the point that I was just so stoned I didn't care about how much pain I was in, which was still an improvement. But it truly wasn't until I started working with Katherine and medical professionals who were trained to know how to use this plant for, safely and for efficacy, where I got to the point where the cannabis was actually treating my pain, not just numbing the symptoms. And that really is a big part of why Leaf 411 exists the way it does, was even from my experience as a patient. This is what I wish had existed when I needed it the most. And we built it with that in mind, is what do the consumers need to know, and who should they be getting that education from? And we created Leaf 411 to bridge that information gap.
So interesting. And Katherine, what is your background as a nurse? Did you get into nursing to become a sort of cannabis nurse?
No, I've been a nurse for 24 years. I've been in cannabis nursing for 4. Actually, I was the opposite. I'm completely opposite of Jennifer. I believed all the propaganda. I wasn't a user of cannabis. I was actually against cannabis use. All my years of nursing, up till 4 years ago. And then I even voted against it in Colorado. That's how recently I was like, nope, I don't understand this. When I used it myself in my youth, it didn't work for my body at all. Now I know why. I overconsumed, and didn't use it correctly. And then also, people that I saw, I felt like were using it just, not motivated, things like that. I had those judgments against it. And then all of a sudden, 4 years ago, my brother-in-law was suddenly diagnosed with stage 4 lung cancer in his 40s, 2 kids graduating high school. and my family's devastated. He has great resources in California, and some of those top lung cancer specialists actually said, well, we look at cannabis, but as a very last ditch effort, and only because we don't understand it and know anything about it. So I decided to take that piece of what was being thrown at him and said, I'm the medical professional in the family. Let me look at see about the validity of this cannabis stuff. That's what was my attitude then. Let me look into that and take one thing off their plate. And when I looked into the typical resources we do as medical professional, PubMed, Science Direct, and all the black and whites, I was actually angry. I was angry that there was so much science, so much data, so many anecdotal studies and research that I thought, why was this withheld from us? Why aren't people screaming this from the rooftop that if there is a plant medicine out there that could potentially have benefit for someone and has no lethal dose known in the history, why aren't we using it as first line defense versus last line defense? So that's when I started getting into cannabis nursing 4 years ago. I started that self-education as I'm going to look into this. I'm going to educate myself as a clinician and then move forward.
So obviously you were a convert,
Yes.
like so many of us, even me, I believe the sort of a lot of the stigma around cannabis before I got more involved in the industry. What was it about cannabis that changed your mind when you learned, when you became more educated about it? What was it that changed your perspective?
Yeah, I think it's the actual science. I mean, when you look at it and you see that we have this endocannabinoid system in our body, and discovered in the 90s, and then you see that there are actual receptors that our body produces compounds that mimic the plant, and you think, wow, okay, there's real science here. I can see the black and white. It's just not hearsay. I think that was the most pivotal point in me changing into becoming a cannabis nurse, is that I can take the science, I can look at the pharmacology of it, I can look at the physiology of it, and I can relate it to what we learn in nursing school. I can relate it to what we learn in medicine. So because there were those exact similarities, I thought, wow, this is real. This isn't just made up. So I think that's when you talk to a clinician, especially who is like me on the other side of it and not believing yet, I think that's the pivotal point, is you have to see the black and white. And then once you get into it and you start hearing more of that kind of, we look at it as that evidence-based approach. I look at what the doctors are finding when I was in the clinician setting, what the patients are coming to saying is their evidence, and then also the black and white science. You put those three together, which is our evidence-based practice. That's what changes your mind. It's like, okay, there's something real here.
Right. So tell me how the service works. Break it down for me. It's a hotline, but is it a number that people call? And by the way, 411, for anybody listening who's under 25 years old, that is the number that you used to dial on a telephone to get somebody's phone number. Does anybody ever dial 411? I don't think I've dialed 411 in probably 20 years.
For years.
But I remember being very into 411 for a long time. And then it was the 555-1212. But tell me a little bit about how it works. How does one engage your service?
Sure. Yeah. So we started with the hotline, and the reason why it was because it's the most easily accessible. I wanted to make sure that people could call, whether you're a mom on a soccer field sitting off in the corner and you're like, gosh, I don't have my laptop. I don't want to use an app. What do I do? I wanted somebody to be able to pick up a phone and call. And, back then I knew it was very antiquated, but I thought it was the easiest way. We definitely had people saying, oh, we should do an app and this and that. It's like, yeah, we can get there in the future. But we needed to start with something very simple. Always simplified is our key. Go simple and then grow. So we have an 844 number. We have a toll-free number. So it's toll-free. It's anonymous. We can take calls from all across the country, and we even have data showing that we've almost had calls in all 50 states. We even have a chat feature on our homepage, which we can take messages through that, and people from outside the country have actually reached us through our chat feature. So we started with the hotline. So it's very easy. People call in. We say, thank you for calling Leaf 411. How may I help you? And then they start off saying, what their questions are. As nurses, we triage each call that comes in. So we want to get kind of the nitty gritty of, what is the base of their question? What is their intention for the plant? And then that kind of leads us to how we educate them. A lot of times they've got 10 different conditions, and we kind of start focusing on their main one. Let's take it step by step. Exactly what we do in Western medicine. So when we're on the floor, a patient comes in, same thing. If you've ever been in a hospital setting or a clinic setting, that's what that nurse does. She finds out, okay, tell me everything that's bothering you and let me find the resources to help you. So that's what we do on the hotline.
And how many nurses are on duty at any given time?
Right now we have 4 nurses. So we have 3 part-time nurses plus myself. We have a nurse covering every shift from 9 a.m. to 7 p.m. Monday through Friday, Mountain Standard Time. And then we also have our chat feature. So there's usually one nurse on at a time that takes shifts, but then I'm always the floater. So I watch the hotline as my nurses are staffing it. And then if I see calls coming through, I can jump in and click on and take calls that are coming through as well, or chats.
And about how many calls do you think you get a day, or chats do you get a day in general?
I'd say as an average, about 15 right now. The typical call takes on average about 40 minutes. And then there's nurse chatting and charting time. So you're looking at wrapping up a call about within the 50 to 60 minute time frame. So when you look at 15 calls, well, that's your day. That takes up your entire time. So, and they fluctuate. We've had calls in the 25 calls a day. Then we've had calls that are about 10 calls a day. So it's a constant roller coaster, depending on the day.
Jennifer, so this is a free service. How does one make money off of this? Because I know you're part of the business side of this venture. So how are you monetizing this?
Yeah, I'd love to explain it. So part of why we became a nonprofit was specifically to keep calls free. That was really important because actually in the beginning we thought, maybe we could just charge, say, 99 cents a minute. And maybe you can afford that. Maybe I can afford that. But there are a lot of people where 99 cents a minute is still going to rack up. And we didn't want anybody to feel rushed. And quality of care for everyone was really important to us. So we had to come up with a way to keep calls free. And I might add, pay our nurses. Nurses, for anybody who has nurses in their life, they tend to be overutilized, underpaid, and undervalued. And we wanted to really show that we cared about nurses by paying them a living wage to do what we are doing. So we have a membership model. As a nonprofit, we get to go after grant funding. We accept individual donations. That can be done through our website. And we're always grateful. $5, $10, every little penny counts to help keep our calls free. But like I said, we have a membership model. And so we wanted to be a platform where the cannabis industry could say, I care enough about my consumers to help financially support this nonprofit to keep the calls free. And that's working out beautifully. So we have members like Juana who are literally putting their money where their mouth is for what they care about, to say, we care enough about safe use and our consumers getting the help that they need, that they are paying to keep this possible for them. And we are so grateful to be partnered with amazing people and businesses in this industry that care as much as we do.
Let's talk about the type of calls that you get in and chats. And is there one question that you get more than any other?
What I learned early on, which is heartbreaking, is that the entire nation is in pain, physical pain and emotional pain. All across the country. And that is the most number one question. I have pain and I'm tired of it. I need to do something else. And I've heard about CBD, or I've heard about marijuana, or, tell me about if this can help me. So I think that's the number one question is, how do I treat my pain? Second to that, it's the emotional part, my anxiety, my depression. How do I treat that? And then it goes from there. But we get questions all over. I mean, that's the exciting thing about working the hotline. You never know what question's going to be thrown at you when you answer. I've gotten everything from the heartbreaking ones to, my wife has cancer and she's dying and please help me, to, hey, I had this one. I'm growing in my backyard and one of my plants just fell over. What's wrong with it? And I was like, I'm not a botanist.
Yeah, I guess maybe that's the leaf. Well, it says leaf in your title.
Yeah, so I still was able to help him. Like, okay, is your watering system evenly dispersed? And let's talk about how you're cultivating that plant, how you're growing it. So we get questions from all over. I think a lot of people right away, their first go-to is like, oh, I bet you get crisis calls all the time, like, are you overconsumed? And honestly, I've had one. I've had
Really?
one, and it was through our chat. Yeah, it was in the middle of COVID when it first hit. He was, in his 20s and normally smokes very high amounts, and thought, you know what, I'm going to respect what's happening, and I'm not going to smoke anymore to, keep my lungs healthy. So I'm going to eat an entire chocolate bar.
A cannabis infused chocolate bar. Yeah.
Yeah, so he figured since he was a heavy smoker that he could eat an entire chocolate bar, and then got himself into trouble. So like I said, we have calls all over the board. You name it, from how do I get a medical marijuana card? Do I need to talk to a physician? How do I find a physician? Questions all over.
What do you tell somebody? What did you tell that person about the chocolate bar? I'm just curious, like, what medical advice do you give to somebody who feels like they've overconsumed like that?
Yeah. Great question. Yeah, so this was on chat. So it's even more challenging on chat because, I have to ask very quick questions typing out. So, first thing as a nurse, we do our nurse duty, which is triage that, who are you with? Are the parents that you're with impaired as well? Are you in a safe space? Yes, you are. Have you consumed anything else with that? Anything recreationally, anything illicit, prescription, all of that? Once we figure out that they're in a safe space, only consumed cannabis. He's not having any kind of cardiac issues at the moment, not any kind of shortness of breath, anything that would, tell me that he needs emergency services. Then I just tell him, okay, this is what you're going to do. You're going to lay in bed. You're going to wait this out. There's no lethal doses of cannabis. So you're healthy in that way. It may feel awful. You feel like you're going to die, but this is what your parents need to do. Your parents need to help you stay in bed, get you water at the bedside, because that dry mouth is going to kick in severely if it already hasn't.
Mm-hmm.
And then also there's some key home remedies. There's cold lemonade. Luckily, he did have some. His mom ran and got him some cold lemonade. It's the limonene that helps. Seeing if he had any just CBD on, in the house.
CBD can help with that.
Can help mitigate some, but it can also potentiate it. So you have to be careful with that. So it's asking him about those, just simple deep breaths. How are you feeling? And just him talking to a nurse, even though it was on chat, he said, I feel so much more comfortable and better that I'm safe. So he said, I'm staying in bed and I already feel better. He was pounding some water, drank some lemonade. He's like, wow, I would have, just the unknown, I think, it inflames that fear. So by us being able to calm that, then he was able to rest and get through it.
Jennifer, you're raising your hand. Did you have anything you wanted to say about that?
Yeah, I do want to add that.
Yes, Jennifer.
We like to say that we are providing the 411 to prevent the 911. So we always love it when a bud tender will say, I'm not a medical professional. These people are, call them first and then come back. Then I can sell you whatever you need. But we love to reach people before they hit that point. But as Katherine said, we will even take those calls. But we're excited to be working with brand new consumers and even consumers like myself who have been using for a while and they still have questions. Our needs change as our health change. And to really feel like I've got somebody holding my hand along the journey, that's what we wanted to build. And nurses have been voted the most trusted profession the last 18 years in a row, even over doctors. So we're taking that trust that the community inherently has in nurses to begin with and applying that to a plant where there's so much mistrust and so much misinformation. And because we are a free service, you can call every single day if that's what you need to feel supported along that journey, that affordability and accessibility were not barriers for anyone getting the help they need, because there is no one size fits all in cannabis. And that is how we are actively providing the 411, the information to prevent the 911 as often as the people need.
What's the legality issues around a business like this? Because when you're offering advice or information. Do you have to be careful about what you can and can't say?
Yes. Yes, we have to be very careful. So, number one, we even have a disclaimer on the phone before they're connected to us that we are not doctors.
Mm-hmm.
We are nurses. We work within our scope of practice. So that's very important. All of our nurses are members of the ACNA, which is the American Cannabis Nurse Association. We have a scope and standard of practice that we rely on, that guide us. So even the national nursing guidelines, another one has, its guidelines that we follow. So we are very we respect where nurses play, the role that nurses play, and then where the doctor fits in. We work with serving sizes, we can titrate, we know where our boundaries are, but we're also going to give that public sometimes the information they're not really wanting to hear. But we do tell them it's time to see a doctor. You have to see a clinician. And the difference is that we can explain to them why.
Mm-hmm.
So they may be told from other people that, oh, you should see a cannabis doctor. And they're like, yeah. But to hear it from a nurse after hearing, why their intentions for using the plant and their condition, we can actually tell them and explain in detail why it's important for them to see a cannabis clinician.
Yeah. And we even took it one step further. You don't just have to take our word for it. Kind of like Katherine was saying, there's actually a lot of research out there. And so in answer to that idea that, oh, there's just not enough research, which we know is not true. There is research. We built a consumer-facing searchable database of that research. So you can type in psoriasis and it's going to pull up the research done on cannabis and psoriasis. So you don't just have to take our word for it. Here's the science to back up what the nurses are saying.
I'm interested in this time during the pandemic, and you did allude to it a little bit earlier, Katherine, with that gentleman that decided to not vape as much, given the pandemic and went to edibles. But are you finding a different type of call coming in now? I would imagine, the three reasons I hear that people generally turn to cannabis are for pain, stress, and sleep. And I'm wondering if you're seeing an uptick in calls dealing with issues that around stress and sleep, lack of sleep.
Yes. Sleep, I think, is number 3 on our list of our data collection: pain, anxiety, and then sleep, or mental health issues and sleep. It's incredibly important. But yeah, we saw a huge evolution of types of calls when the pandemic started. At first it was fear of touching a package. Is it going to have the virus on it? We had to talk to people about that. Then it was this fear of, well, I heard you can't take ibuprofen, and CBD and THC have anti-inflammatory components to it. Can I still take that? And then it, what else can I take if I'm trying not to smoke? And then now it's, we do get a lot of calls that people are just outside looking for different treatments. They're looking for integrating a different type of alternative medicine. So I think that pandemic has done that as well, is now a lot of people are exploring different ways. They don't, unfortunately, a lot of them can't or will not go into a facility anymore for fear of the virus. So they're trying to take care of it on their own. And we definitely educate them about not stopping their cannabis medicine. We don't want to, we talked to them about that a lot in the middle of the pandemic. Like, look, we don't want to overstress our healthcare systems right now. The ERs, the doctor's office that are trying to take care of the COVID patients. Let's stay on your cannabis medicine, and we'll help you. We'll guide you on how to use it safely and effectively.
Do you find that most of your callers have experience with cannabis already, or are there a lot of newbies that are calling, like first timers?
Yeah, I would say, in the beginning, I was shocked how many newbies.
Yeah.
I was shocked how many people hadn't even tried CBD hemp or a THC product. And they was just curious, from all over the country. I'm always surprised by that. Now more people have at least tried a hemp product. And they're wondering either, why isn't it working? Do I need to move on to a THC product? There's a lot of fear still with that. I think in our last data set, about 60 to 65% of our callers were over the age of 55.
Interesting.
So we have a lot of seniors that call us, which, as we all know in the industry, are the, largest demographic of new users. So, we're filling that need. They're out there. The seniors are the ones with comorbidities, which means more than one condition that they're trying to treat. Polypharmacy, which means they're on usually more than one pharmaceutical. So you have the largest number of users that have these other things going on that we have to be very keyed in on. Okay, how do we guide you to use safely? So I think that it has changed now with CBD hemp all over the place, from gas stations to shoe stores to, tanning salons.
Yeah, that must be hard because there's so much snake oil
yes.
in the CBD space, much more than in the cannabis space, because the legal cannabis industry is regulated.
Yep.
Mm-hmm.
The CBD hemp industry is not, and therefore you can, sometimes you have this fake stuff, and you're not really in a position, I think, of saying, what are you using? Well, that's fake. I mean, you wouldn't know. I don't, or maybe you would. I don't know. But so how do you determine whether they're even using a good product?
Yeah, good question. So, we're online. So we do, voice over IP. That's how we answer our calls. So we're here online. So when someone calls from, say, another state, and I've never heard of the hemp product, or somebody's own special formula that they have, first of all, we'll have them read us everything on the packaging. But I'll tell you, I've had plenty of callers that say, well, it doesn't really say anything. I got this from a friend, or the bottle just says CBD. And so, we'll say, one of our nurses, her go-to is like, I can't confirm nor deny, anything about this product because we don't know it.
Yeah.
We don't know what it is. So, it could be a legitimate product, but because I don't see it or I can't look it up, which we do, if they have a name, I'll instantly look it up online and see if I can find out information. And if that company isn't transparent, and I don't know an about us about them, I don't see a COA or a tab that I can pull up a certificate of analysis. I don't see on the packaging, they're not clearly identifying, the ingredients that are in that package. I'll tell them, look, based on what I'm seeing, it's something that I can't comfortably suggest to you because I can't see the information that I need to know that's that puts confidence in me that it's a legitimate product. So we just guide them on what to look for.
Right.
And if a product doesn't have a list of ingredients, that's one key thing.
That's a red flag right there. Yeah.
Right.
Jennifer.
Well, and that's a big reason why we put every single business we work with through a vetting process. Because when we have somebody come to us, especially brand new users, saying, look, just tell me where to go and what to get. We know not everybody's going to ask for a COA and then know how to read it. And, they're not doing at-home testing. So the next best thing, we are doing our due diligence on behalf of the consumer, because we are consumer advocates first and foremost. And in an effort to be a part of the harm reduction, we do our due diligence. We tour the manufacturing facilities. We review the COAs. We meet with management so that we can say to the best of our ability on our end, this is a product we are comfortable with and that you can be comfortable with. And that's really important. So if you are thinking, okay, I want to try this, I'm not sure where to start, our list of manufacturers is a great place to start because we've done that due diligence for the consumer so that they don't have to worry about that. We worried about it for them.
But this is so fascinating. So if people want to call that number, what is that 844 number?
It's 1-844-LEAF-411. That's 844-532-3411.
Such a great service you guys are offering. Thank you so much for coming on the show to talk to me more about it. Leaf 411, Katherine Golden and Jennifer Axcell, thank you so much.
Thank you.
Enhance Your Life is brought to you by Wana, the #1 infused product in the U.S. Wana's entire process is designed to deliver the same great experience time after time. They have spent years fine-tuning their recipes so that their products are delicious, consistent, and potent. For more information, check out wanawellness.com. That's Wana, W-A-N-A, wellness.com.